so much, Council Member Rory Lancman, for joining us on ITV Gold. Just beginning this interview, I have to ask you the biggest question of the hour: reopening of New York City. What is your take on reopening, and what is the vision of the New York City Council? What should we know about this as New Yorkers?
Sure. Well, I can only speak for myself, of course, and on behalf of the 160,000 residents of the 24th Council District. I have a lot of ITV viewers, especially in the Jamaica Hills, Briarwood communities, and it's nice to be able to communicate to them and to your audience. I think we need to be very, very cautious about reopening. We have seen in other countries where they have reopened prematurely, and as a result, there have been spikes in new coronavirus infections, and I think that we've seen that elsewhere in the United States as well. And so, I thank God I'm healthy. My family's healthy. We've been through whatever we've been through. We are managing. It's very hard. It's particularly hard on people who've lost their jobs and our frontline workers. But it would be a tragic mistake where we have successfully flattened the curve in New York if we were to prematurely get back to our lives and reignite the coronavirus amongst us. I don't see us doing a broad opening measured in weeks, more like months. But I think you will see piece by piece and just seeing how each piece develops.
Let's talk about District 24 real quick here. It has one of the most populous communities of South Asians, and it also has a lot of Indo-Caribbeans living there as well. Immigrant communities are really at the heart of this epicenter pandemic in New York City. What have you seen in this entire process of COVID-19 impacting the immigrant communities, and what resources are now available for them?
So, it's really tragic that our immigrant communities have borne the brunt of the coronavirus pandemic. And it comes from a number of reasons, including people living densely together, lack of access to healthcare. That lack of access to healthcare has also created somewhat of a reluctance on people's part to seek out healthcare because they can't afford it. So many of our immigrant neighbors and friends and constituents are in the industries that keep them on the front lines, whether it's healthcare or the service industry, in restaurants, in civil service jobs like working for the MTA. And so the immigrant community, whether it's in my district, in Jamaica Hills, or in Corona, or in other parts of the city, have been particularly hard hit. And we've tried to ramp up our support for those communities, whether it's in terms of food pantries or access to healthcare services. But there's just no getting around it. The immigrant community has borne the brunt of this crisis.
How do you hope to resolve some of these issues in the next few weeks?
Well, I don't. I mean, I wish I could, but I don't. These are systemic, deep-rooted problems and inequities and realities in our system. And right now, we are trying to cope with them through Band-Aids. And as I said yesterday in a different interview setting, I hope that we learn our lesson from this crisis, and a lot of the things that we are doing as Band-Aids become more full-time policy, making sure that everyone has access to affordable quality healthcare, that immigrant communities have organizations that are culturally competent that they can reach out to for information, for guidance in how to get services, that we have a system of unemployment insurance and other supports, social safety net supports that people can rely on in times of crisis, but just in people's everyday lives, which are hard enough.
Councilmember, you sit on the Committee of Justice System and as the chair for that. And this entire scenario of COVID-19 has really brought in this fight for justice and how justice has to be served no matter what. We're seeing a rise in crime. We're seeing a rise in domestic violence, especially in New York City. What do you have to say about your own observance of this? And what does the council need to do to attend to these issues of crime and violence increase during this pandemic?
Well, you look at the justice system. First thing that comes to mind, of course, is the criminal justice system. And we, and I say we, the council, I think played a very, very important role in trying to get as many people out of Rikers Island as possible, consistent with public safety, to protect the people, the detainees, the inmates, the civilian staff, the correction officers. And I think that the city did a very, very good job of that. And if you look at who's sitting on Rikers Island, let's just say that people of color, the immigrant community are sadly overrepresented in our criminal justice system. But we also need to focus on the civil justice system, the things that people can find themselves in a courtroom for that is not, they've been accused of a crime, but they might be at risk of losing their apartment, being evicted from their apartment, or having their home foreclosed because they can't pay rent, they can't pay their mortgages. People who are at risk of losing custody of their children, people who have to go to court to be able to get benefits that they're entitled to. The whole civil justice system has, for the most part, frozen during this crisis. And this evening, I don't know when this is going to air, but Thursday, May 14th, 6 p.m., we are having a virtual town hall with civil legal services providers to answer people's questions on immigration, family, housing, elder law, other matters where if you don't have a lawyer to represent you, you can really be out of luck.
Yes, definitely. And I think that's so important for the community to know, especially the ones that are suffering. Do you have a message for people that are suffering and they really need help? How can they reach out to your office and how can they go about really seeking help?
Well, first, let me say to everyone who's suffering and particularly to people who've lost someone to the coronavirus, how profoundly sorry I am for your suffering. The truth is, all of us have known somebody, either very, very close, intimately in our family, or close enough, who've been lost to the virus. And it's just terrible. It's devastating. It's impossible to make sense of. But know that at least your government here in New York City, all of your council members, your assembly members, your state senators, your governor, your mayor, we are all fully, completely engaged in trying to help people. Not all our decisions will be correct, will be wise, will end up being right. But we are here for you. For me in particular, you can reach my office, 718-217-4969. My whole staff is working remotely. You can email us, rlancman@council.nyc.gov. You can find me on Twitter. You can find me on Facebook. We are here to serve you and to help you. And if you think you're feeling alone and feeling desperate, you will be shocked to learn how much is here, both from the government and from nonprofit organizations, how much is here to help you. So reach out to us.
Definitely. Any comments on tackling the problem of hunger in your district?
Yeah, I mean, the things that we take for granted, not that there aren't people in our city who go hungry every night, not that there are people in our city who have to sleep on the streets or in a shelter, but the things that we broadly take for granted are now under tremendous pressure right now. We were just in the middle of dealing with a situation where the public housing development in my district at Pomona is experiencing an acute food shortage. That last week we had almost 600 people line up for the weekly distribution of food, and it wasn't enough. So the city has allocated tens of millions of dollars more towards our regular ongoing food pantries and food delivery system. The mayor has appointed a food czar, Catherine Garcia, who is commissioner of the Department of Sanitation. And all of your local elected officials can connect you with someone or some organization that can get you food. So if you're hungry, or if you know somebody who's hungry, and everyone, let's be checking on our neighbors, particularly our elderly. If you know someone who's hungry, call us, and we will connect you to make sure that you get food.
I want to now talk to you about the economic ramifications of COVID-19, especially on New York City. I know you're currently working on a budget to protect small businesses and other outlets that are really catering to the immigrant community, businesses owned by immigrants and other communities. Your take on how are we going to stabilize the economy? And what is happening in the budgets for these small businesses? Because they're really the heart of the city.
Absolutely. And you talk about the immigrant community in my district, you're talking about particularly the South Asian immigrant community. You're talking about, look at Hillside Avenue, all the stores, all the small businesses there that are now shuttered and people can't make a living. When you talk about the economic devastation, you're talking about employees who've lost their jobs, don't have regular paychecks, and making sure that our unemployment insurance system is funded and that it's functional and that people are getting the unemployment assistance that they deserve. There's been a huge rush on unemployment claims in New York, and the state is trying to process them as efficiently as possible. There's going to be federal, city, and I'm sure state programs to assist small businesses with payroll, with loans. Just yesterday in the city council, we passed a bill that would, not, for at least for the duration of this crisis, not allow a small business owner to be personally liable for their lease if they can't operate because of COVID-19. And so I think you're going to see a lot of financial assistance. We're going to see regulatory assistance. We just passed a law yesterday in the council that all of our small restaurants were very much in favor of limiting the fees that firms like Grubhub and Seamless, et cetera, can charge, delivery fees, which are really hurting small businesses. So I think you're going to see a combination of direct financial support, loans, regulatory relief, and hopefully also those of us in the council are pushing for some kind of tax relief as well.
You know, I have you for a couple of minutes. I have a few more questions left here. Number one, that's something that's we're getting from many members of your district, schools and the education system. It is incredible how everything has gone remote, but there are students in New York City and in public schools that need access to education. I want to have your comment on what you think has happened with the education system and how is New York City really tackling and making sure that each child gets access and resources for this.
All the kids who needed tablets have gotten them. We did a town hall meeting. My office did a virtual town hall meeting on remote learning to understand all of the different problems and challenges there are, and the lack of a unified curriculum, and of course, a lot of students. How do I put this? School is the most stable, comfortable place for them.
Right.
Home environment, for a variety of reasons, just because it's crowded and work is very hard to learn in. So, I think that we're doing the best that we can. I think there are definitely things that can improve. We hope we're going to try to limit the budget cuts to education and other youth-related programming. Obviously, remote learning is not a long-term solution. I'm hopeful with my fingers crossed for luck that we'd be able to open the schools in September. But that really has to be entirely driven by what our public health professionals are telling us. The town hall that we had parents calling in, we had teachers calling in.
Right.
People are trying their hardest to make it work. And I think it's a testimony to the spirit of New Yorkers that 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 people are trying their hardest.
Yes, sure. Council member, what is the focus of your office for the next couple of weeks? What are you trying to tackle in the next coming weeks? Because we are moving towards somewhat of a reopening that we keep on hearing. The nation is also reopening. I would like to know what your focus is.
So, it's always a combination of things as a council member, and this was true when I was a state assembly member. The things that we do at City Hall, the kind of big picture things, which are so incredibly important. For the next month, it's all about the budget. New York City's budget is due on July 1st. We are facing a multi-billion-dollar shortfall in this year's budget, as well as in the budget that we're negotiating to start on July 1st. And so I serve in the council on the budget negotiating team. I'm just coming off and took a break from a budget hearing related to the police department. My own committee is having its budget hearing next week. The big picture work for me is making sure that we get a fair and equitable budget that has the least amount of harm, particularly to young people. Schools, summer programs. A kid can never get back a year or a semester that's lost.
That's true.
But the combination comes from also putting out fires, dealing with crises in the district. And I mentioned that we've got a food situation happening at Pominock. Tonight's town hall is going to reveal how many individuals, particularly in the immigrant community, are having legal issues that are not getting addressed. So continuing to deal with those fires, put them out, try to help people with the basic fundamental needs that they need right now. At the same time, making sure that the budget that the city passes as a whole is fair and is not balanced on the backs of the needy and children.
Yeah, definitely. Councilmember, thank you for your time on ITV Gold. I would like for you to address the South Asian community while we're ending this interview, but if you could also address all the essential frontline workers that are working so hard in your district, that'd be great too.
Yeah, just the heroism and the courage and the dedication of the doctors and the nurses and all the workers in the hospitals, whether you deal with patients or not, just being in that building, in that environment, the emergency medical technicians who go out in the ambulances. We're just so grateful for your courage, your professionalism, and your dedication, because you're the ones who are helping us, enabling us to defeat this virus. Everything that the rest of us are doing are basically in service of and in support of your work. And to my many, many South Asian constituents, so many of whom I count as personal friends and neighbors, yours is a very, very resilient community. There are so many different mosques and social services organizations and fraternal organizations just within Jamaica Hills. Nobody should feel alone. Nobody should feel that they're confronting this crisis on their own. And I know that within the South Asian community, in particular in my district, I see people helping each other in all the different ways that they interact with each other.